titled The Top 20 Causes of Joint Pain. You see that joint pain itself is not a disease, but it's a sign, it's a symptom on its own and has underlying causes. And I'm going to show you 20 key causes of joint pains. You see, before you understand this topic, you should understand the structure briefly of the joints. But remember, we need our joints to be mobile, to lift, to walk, to be independent. Otherwise, we can age gracefully. You see, when you look at a joint, every typical joint is made up of bones. As we know, 2 or more bones. And in between the bones, we have the cartilage. Is a smooth tissue that cushions the bones, and it helps with the friction free during movement. And when this cartilage depletes of minerals, that's when people have knee replacement, because it causes osteoarthritis. Then we have the synovial membrane. The synovial membrane is a lining. It's like a blanket that blankets the joints and produces synovial fluid to lubricate the joints for better motion. And we have the ligaments, which is very tough bands of tissue that connects the bones and provides stability. And then we have the tendons. It connects the muscles to our bones. That helps with movement. It makes it easier. And the muscles, we have muscles that surround the joint, and then actually is the force. It provides the force needed for motion or movement. And you know, all these, if even one of them is affected, you have joint pain. But they all work together to provide comfort and good motion and good movement. Now, number one most common cause of joint pain is osteoarthritis. Osteoarthritis is a degenerative inflammatory condition. It involves, if when you say degenerative, it means that it gets worse with time. You'll be losing minerals, and the cartilage that cushions the bones, of course, will be depleted, it will shrink, and then at some point, 2 bones will rub against each other, and it's so painful. That's where people go for knee replacement. But the most important material that actually is absent or reduces, that could lead to osteoarthritis, is collagen. With age, we are depleted of this collagen, or the collagen breaks down. But the raw material for collagen is vitamin C. So you can't just buy collagen and take it, because even your system may not absorb it. So you have to provide the raw material for the body to actually produce its own collagen. And then also taking natural sources of calcium and minerals, and with magnesium, vitamin D3 and K2 to help the joints with the B vitamins. It means all the greens. The next cause of joint pain is rheumatoid arthritis. It's autoimmune disorder that your immune system overreacts and attacks the synovial membrane that lines the joints, if you remember, which produces lubricants to lubricate your joints. It can release cytokines in rheumatoid arthritis. Cytokines are released, and that can lead to damage of tissues. And then the next one also, which also quite common, is injury or trauma. So when you experience any trauma or injury, it could cause damage to your ligaments or tendons or the cartilage, and that can trigger inflammation. That is pain. The next one is gout. When you have gout, it means you have deposition of uric acid crystals in these joints. It could be in any joint, but especially the big toe. But if you have gout, it can be indication of dysfunction of kidney. It means your kidney is not filtering this substance well. But sometimes some people may eat too much sardines or seafood. That can also contribute to gout as well. But the kidney should be functioning. So when you have gout, remember to check your kidneys. The next cause here is infections. That is septic arthritis. Here, when you have bacteria or viruses and your immune system is not stable, your immune system may overreact, causing severe inflammation in your joints. Bursitis It means the inflammation of the bedside. What is bedside? Bedside is fluid-filled sacs that are located, in fact, throughout the body, mostly around the joints. When they're inflamed, they can cause pain. Tendinitis. Tendinitis is normally will result in the inflammation of the tendons. The tendons connect your bones to your muscle. When they're inflamed because of microscopic tears in the tendons, it can lead to also pain and swelling in your joints. Lupus. Lupus is autoimmune disorder that normally your immune system will attack the synovial memory in your joints. That can cause also pain, mostly the knee, the elbow, and the hips. And then we have a fibromyalgia. Fibromyalgia, here your brain may be working differently, and it may have sort of abnormal pain processing. It's an abnormal pain processing in the brain. The brain may amplify sensations. That is the pain. That is fibromyalgia. And then we have underactive thyroid. If your thyroid is underactive, it can reduce your metabolism, and that can lead to tissue stiffness and intensify pain in your joints. When you talk about metabolism, it means your body's ability to convert food into energy. If it doesn't do it well, you have the stiffness and pain in your joints. And then psoriatic arthritis. Psoriatic arthritis is also autoimmune system problem that actually creates psoriasis. Psoriasis is a skin condition characterized by normally red scaly patches. If you're a person of color, it will be dark scaly patches, and normally can cause this sort of form of arthritis and cause pain. Osteoporosis is a weakened bones that will normally, if your bone is weakened, it will increase the stress on the surrounding tissues and the nerve ending in fractured areas that can trigger pain. The next is overuse or repetitive motion, maybe depending on the kind of job, occupation. That will not actually cause direct problem, but it can cause inflammation in your tendons and the surrounding tissues as well. The next is obesity. When you're obese, excess weight increase mechanical stress on your joints, especially in the knees and hips. And then we have a tissue called adipose tissue that will release inflammatory chemicals. We call that adipokines. That will increase the pain. So it's important to have the right weight. Avascular necrosis. What does it mean? It means that your bone tissue dies because of lack of blood flow. So blood flow to your joints is so important. The next is hormonal changes in both men and women. When the estrogen in women reduces, we have mineral loss, and then also testosterone in men. It affects the cartilage, and the stiffness and pain can actually ensue. Lack of vitamin D, magnesium, vitamin K2, and zinc, and the B vitamins. If you're lacking, it creates problems in your joints. And neuropathy, that is damaged nerves, can misfire, sending pain signals even without injury, can misfire that. And then of course, cancer issues, when there's a metastasis, okay, it means the spread of cancer, it can cause joint pain as well. And the last one here is allergic reaction. When your immune system is not stable, your immune system may overreact, releasing histamine, this chemical that will cause pain in your joints. You've heard the 20 key causes of joint pain. Joint pain is not a disease, but what? A symptom. If you have any chronic problem, one call away, your life will never be the same. Join me, go to my YouTube channel, subscribe, put in Dr. James Natural Link, Dr. James Natural Link, and go there to subscribe, share those videos, and support the channel. One call away. This number we're calling outside the UK is +44 738 464 7300. If you're calling within the UK is 0738 464 7300. Please share this number, be a blessing to somebody, and God will bless you.